Have you? I haven't used order sets at all yet. I didn't know if you have used it and found it beneficial for any coding in your practice or anything, or is there a certain procedure you favor order sets for, or how do you do that in your practice?
I still try as I might. I still don't use any order sets.
Okay. All right. Just checking with you. I haven't used any yet either. So.
You know, I tried. I have plantar fasciitis, and I have a couple order sets, and I added it to. I clicked those order sets in the template when I made it, and they show up with the template. And I click the template, and I click the order set, and it says you don't have a diagnosis. So I'm still a little perplexed by them, and haven't found them as useful as I thought I might. I don't know, at least at any of your trainings or when you guys talk to people that have been on it for a while, do you guys talk about anything like that? Anybody you know of?
We do talk about it a little bit.
Say again, Lisa, I'm sorry.
I'm sorry. We do talk about it a little bit. You know, lots of times the order sets are triggered by a diagnosis. And sometimes if you pull up the order set, like we made one actually today that combined two of them with Dr. Blackwell, where he used two combined into one, and he put in any possible medications, you know, diagnostic imaging, things like that, where he could pull that up and just order it, but we did not put any diagnoses in to trigger that.
Right, because you would, those order sets, that order set could be for multiple different diagnoses.
Right.
Yeah. So a good place to use that is in the treatment screen where you have your, diagnoses listed, and next to each of them are those three little buttons. One is notes, one is something else, and one is order set. So that's a good place to use a order set because you already have the diagnosis.
Can you do a sample real quick on that?
Sure.
And I did a really good, I guess you would call it a macro on wound debridements. Lisa, you helped me with that for procedure-wise. It's really good as far as getting all the information needed for a wound debridement because I copied it from our wound center and I couldn't find a good macro in it. So it's open to anybody at InStride who wants to use it.
So where I might use, where I have certainly used order sets, would be as if I have a diagnosis already.
Okay.
And I'm here in treatment. This button is order set.
Where are you right now? Hang on, you're moving fast for me. I'm sorry.
Sure. I am here in the treatment section.
Okay.
Which I was at assessment here. I started by clicking assessment over here, and I added plantar fasciitis from there, and then hit this treatment button down here, which took me to the next screen. And then it lists my diagnoses, and this button is order set. Now, it does bring up, this order set seems to be tied to plantar fasciitis. I think this came, I don't know if I think this might have came, yeah, I think this was not something we made. This was something that somebody made prior to me, at least prior to me starting, that is tied to plantar fasciitis, and I really would have to figure out how to change that. But if I look at, like these are mine that I've used, here's one that I have for plantar fasciitis, right? And so I could prescribe Mobic, which I do a lot. I could take an x-ray, right? And I've already talked to them, and I'm going to give them an injection. And then you would order these selected things, and it would put them in your list. So like order selected. So I have my medicine and I have my x-ray ordered.
Yeah, I don't see the benefit of speeding you up much with that, but anyway.
I agree. I got to imagine that there are ways to do it or practices that This is my patient that comes in because of his lipids, and every time he comes in with hyperlipidemia, I order this blood test and this blood test, and I send him for this, and I do that every time, and maybe that's a good way to do it. I certainly much prefer using templates right now because I get the diagnosis for free, so I use a lot of those.
So let me ask you this with your templates. I see yours to the right.
Yep.
Is there any way to change the order?
No, they're in alphabetical order. So yes,
Okay.
you have to change the way you name them.
Okay.
That's why I worked very hard to try to name them in a consistent way, so to keep things together.
Yeah, I need to go back and fine tune mine because I'm struggling to find certain ones that I've made, and it just gets lost in there.
Yeah, and if you have a lot, there is this little search box here. Yeah.
Yeah.
So if you have these are my PL for plantar fasciitis, and oh look, there's a pes planus too, right? So the search box is helpful.
Okay.
You said you made either a macro, did you think, or?
Yeah, I made a little macro for wound debridements under I guess it's not under templates, it's under the treatment section. Under the procedure section. I'm sorry.
Okay. So like one of these guys?
Yeah.
Like a new one of those?
I have more options than you do. I still have you probably just got your options there, right?
Yeah. Let's take a look at it.
Okay. Debridement wounds, there it is, checked. See it?
This one.
Yeah. Yeah, there you go. So basically it's a list. It just goes through. If you click on like pre-debridement measurements, I just threw some options up there. You can add more if you want, but those are just ones I did today.
And then post-debridement.
Post-debridement, it just goes through, did you use anesthesia? You can click. It goes through everything. It was what our wound center had, and it just was what they had for what they did up there, and that it's foolproof as far as audits go and all that. And hopefully people will add to customize it to how they do it. You mean?
Yeah.
Obviously, I took when you said I put the 15 and 10 blade because you said I guess auditors don't pay for curette.
They do not. They do not. My understanding
I've already learned.
Yeah. Scalpel, scissors. I think that's what Learman told us.
Scissors.
That's great.
Okay. I need to add scissors in there. So
there you go.
It just is a good point and click to go through if you do a wound that you're having everything they would ask for. I
agree with you. That is an absolute great way to do it for sure. What I might consider doing, especially for things like, I don't. Where is it? Where did I put those instruments? Oh yeah. So I may use a scalpel. I may use a scissors. I may use a curette. I may use a tissue kneeper. You know what all mine say? Scalpel and scissors.
Okay.
Yeah. So consider.
I like it.
Making that the default, right?
I don't have any defaults yet.
That's right. And then you come down here and you click that, and that one's done.
Right.
So you could do that for several of the things, like blood loss, right? That's pretty specific, right? You could also have something like, because this is, we do this in the operating room, minimal.
Right.
Right?
Sure.
Because I would question, do you think that was 1 cc of blood loss or 2 cc's of blood loss on that? Right? I get it, and I appreciate the specificity because that's excellent, right? But I think you can save yourself a little trouble.
Right.
But that's great. This is all the stuff that if any auditor looks at this, they'll be like, man, I don't have to look at this anymore. Look at all these categories he has documented. I think we're fine.
Yeah, I just felt like it wasn't a good one. But yeah, I hope people improve on it. Like you've already said some things, and I hope people will take this and improve it with whatever they want to customize with it. So do you ever pull in the previous note and merge it into your note? If it's follow up at-risk foot care, and it's the same thing. Do you ever just pull in your previous note and make a how do you do that, or how do you look at that to speed time up?
The only place I typically do that is the examination, especially for class findings and stuff. I do that all the time because they almost never change, right?
Right.
But I'm cognizant that, listen, I need to individualize these notes for these people. I find it much easier to individualize them in the HPI and in the plan, because objective findings are objective findings. They may not change. Like really, 3 months ago, no pulses, no hair, thick nails, the same. No change, right? So I try to individualize it, HPI and treatment, even if it's like patients who saw her primary care doctor and said blah, 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 right? Just so it really looks like somebody was there with this patient. But I do pull the old exams. Now I will also, what's
the best way to do that?
Oh, sure. It's this button right here. All of these have this little down triangle.
Hang on. Where are you? I'm trying to think where you are.
No problem. I am right here next to the word examination.
Okay.
There's that down triangle there.
Yes, I see you now. Sorry, this was a delay.
Cool. Yeah, no problem. There's one here by review of systems. There's
when you click that, show me when you click that. What do you?
So what you get is the most recent 2 examination sections. You can get more by hitting this more detail button up here, and you'll get more of the times they were in, and you can open them up.
Okay, this is good. This is because I haven't used this at all yet. Of course, I've only been using it a month or 3 weeks. So.
Yep. So you can open them and see all the things that were done. And oh, look, this time for whatever reason, I had a podiatry exam, I had a general exam, and I had class findings. But you know what? I only want to bring forward this class finding. So you click the checkbox next to it, and you can do 2 things: copy or merge. And just like everywhere in ECW, merge would add it to stuff that's already there, and copy would replace it. So we can merge it in.
Just that section, or what?
Just that section I had the check mark next to.
Okay.
Yeah, and then I merged it in. So here's a great one. Here's a class. This is what my class findings looks like most of the time. So I may go in and say, oh, you know what? Today there was a.
All right, where did you go in there?
I'll show you.
Remember, it's a delay a little bit for me. That's why you go slow.
No problem. So this is my exam that I just brought forward by clicking the down arrow button. My class findings and exam, and I have all of these. And I said, oh, you know what? This is all right, but today this callus was somewhere else. So I clicked this green heading, hyperkeratosis. And it brought me into that section of my procedure, right? And then I could, change it, and no calluses noted. And okay. And then when you click OK, it takes you back to here. This button, this word hyperkeratosis, will open up the section of that exam, and I could go and change it here if I wanted to. If I were to click this heading that says class findings and exam, that would take me back to the entire class findings exam, and I could go back into any of the sections that I wanted.
Okay. All right.
So yeah, these down arrows, I rarely, but I certainly have had patients come in and they need another heel injection. So I might go into this procedures down arrow here, which would bring up all the list of procedures that were done in the past. Same kind of box, shows you the most recent few, and then more details would get you more. This
Yeah, this is
had an
still
X-ray.
since I'm still new. I'm just now getting patients back again. So yeah,
Yeah,
this is
sure.
good.
Yep.
I don't have this drop down as much as you do yet.
Yeah, right. So yeah. So you like, oh, I just gave another injection. I will click that box and merge it in, and now I have my injections that I did last time. So those down arrows are pretty good. You know, that is pretty powerful. So I'm always careful, or I'm always try to
So
be
let me ask you
careful.
this right here: Are you going to treatment section and ordering those procedures first, and then putting them in the procedures?
Yes, I would definitely do that. Like if I was going to do an injection for this plantar fasciitis, I would click the treatment button and then
And then
go
go to
into
procedures.
procedures. Now,
Right.
unless it's a procedure I already have templated, right? So
Right.
I have my plantar fasciitis injection is already templated, and if I give you a preview of it here, all it's got is the assessment, the injection procedures, both the injection and the two medicines, and it starts my procedure documentation for my injection, but it does not put it in because I don't know left, right, or both.
Okay. Yeah, you don't have. That doesn't have. I injected the right or left heel.
Correct. Now, you could certainly make 3, right, left, and both,
Right.
right?
Yeah, I've done more macros right and left.
Yeah, I have some of those, so which I think can be really, really smart to do. I don't have my nail debridements templated either because I customize it for how many nails, right? They're missing a leg, they're missing a nail, they're missing a toe. So I don't have my 11.721s automatically pre-populate, nails divided by 10. I have it started and then I finish it.
Right. Do you ever use under the plan? Do you ever use the diagnostic imaging underneath the red ones there, or the orange ones?
I don't believe I had, but
it's the same thing as going to the treatment section, really.
You're absolutely right. It's just one less click, right? So if you're not in treatment, but you already have a diagnosis and you want to do an X-ray, save yourself a click by just going straight to diagnostic imaging instead of through treatment.
Okay.
I'm all for saving a click wherever I can. They add up.
How do you if you pull over the wrong template, how do you get rid of that?
So if you pull over the wrong template and that's the only and first thing you've done, I believe, and Lisa will tell me where it is because I don't have it favorited, that there is a blank template. And basically what it does,
yeah, she showed me that. I got that.
Okay,
it just was a pain.
It is a pain, and I don't know of any other way to do that.
Yes, I've had to redo some because it wasn't lining up how I wanted it, and especially when I was doing bilateral injections was kind of difficult. And but I figured it out. You just keep playing around with it. So.
Yeah, yep. So I have definitely done that, and it is not enjoyable to have to delete a whole bunch of stuff out of there.
Right. I like how you have your template. I like that onychomycosis, negative fungal stain, no treatment. That's good.
I use these all the time.
Yeah, that's
So
good.
this one, this probably is the one I use the most. So the patient comes in, right? Hey, my nails have been fixed since World War II. I'd like to try to get them better. And you say, okay, well, I'm going to take a sample and I'm going to send it to the lab, and then I'm going to have you come back. That's what I do, right? So in this template, this saves so much time. I use it. So I use onychogryphosis. You could certainly use onychomycosis. Doesn't matter. I put in my blurb in the plan under onychogryphosis, discuss, discoloration, dystrophy, maybe fungus, don't know, going to test it and have you back. But I also start my lab.
Okay, yeah.
And I put in my follow-up as well.
Right, I put my follow-up in my template too.
I start the lab, right? Because I'm just gonna get rid of this just to clear up our.
Yeah, I haven't done the starting the lab. My staff does that for me, so that would be maybe you got to show me that real quick.
Yeah, so if you're gonna click a template anyway, right? So here's that one we were talking about. It puts the lab in. Now I typically go in and I assign it to my my assistant, and I click this and I do print it, because usually I can do that while I'm talking to them. And if I don't, she'll say, did you print something for blah blah blah? I'm like, no. She's like, all right, I'll do it. But I do all this and send it to her, and then she does her thing and assigns it to the lab InStride.
Yeah, I'm not doing any of that. Caitlin's doing all that for me, so I don't really. Anyway.
Yeah, but if you're gonna make a template, put the lab in it.
Right.
You just save somebody like 4 clicks.
Right. Okay.
I tried to put referrals in, like a plantar fasciitis referral to physical therapy, but I could not get it to work right. I need to go back to that at some point, but it didn't seem to work.
Sure.